Good morning, good afternoon. So today we're going to discuss here social innovation in healthcare delivery with the specific implications for HIV and other co-infections. So during the presentation, we looked at the healthcare delivery gap and how social innovation can help address it. We'll define what is social innovation in health and give examples, provide examples of social innovation that are related to HIV/AIDS and STIs. Then we'll introduce the social innovation in health initiatives established in 2014 in order to address the healthcare delivery gap and advance social innovation. And we'll discuss how to join forces and how we're engaging anyone interested to contribute to this journey. So half of the world lacks access to essential health services, and that creates a huge healthcare delivery gap in low and middle income countries, especially. So social innovation in healthcare delivery is a great opportunity to address this gap. And we'd like to see through this presentation how that can be and how this is actually achieved. So what is social innovation in health? It is first a new lens to health system transformation with a more holistic approach. It is also a creative solution, a solution to address systemic health challenge, reaching vulnerable population, an effective, inclusive, and affordable solution. But it's also a process, and that is very important. It's a bottom-up and participatory process, engaging communities, governments, other actors, a multi-sectoral and multidisciplinary approach, and importantly, a people-centered approach. So there are several examples. I mean, we have identified many social innovations and researched some of them. And here is an example of the Broadridge TP-Down referral model that is based in South Africa, and that was established in order to support and enhance HIV testing. So very related to the topic of today, and a model that is actually not difficult to put in place, but has been very powerful in providing that support. So this is a public-private partnership model, referring public sector HIV positive patients to the private general practitioners. And in doing so, it enhances the routine HIV care for patients and reduces the pressure on an overburdened public primary health system. So for that has been very helpful in terms of providing this support in a simple and not very expensive way. The second example is called Contagious Kindness, Pay It Forward. This is a novel STI control strategies in key populations developed by SIHI Global, which is the social entrepreneurship to spur health that is based in China. And this innovation has been recognized by WHO in various instances, UNAIDS, and other organizations. So what it is, it's again, a simple idea, method that has helped to enhance the testing of some population at risk. For the test for gonorrhea, chlamydia among young men who have sex with men, they are offered that test, and they are also then, as a person, they are offered the opportunity to actually pay for the test of the next person. So in essence, by offering a free point of care test to young men at risk, this model empowers individuals and builds community support. Indeed, as part of the pay it forward aspect, the initiatives give these men the opportunity to donate a free test to other young men. And interestingly, this has really enhanced the testing uptake, actually. And an anonymous act of kindness and generosity has been shown to support access to effective healthcare delivery. And that was demonstrated through robust research based on randomized clinical trials. So very interesting examples just to illustrate how with simple and not very expensive, affordable innovation, one can really support the system. So what if there was a way to advance social innovation in healthcare delivery in low and middle income countries? We were asking ourselves in 2014 when we decided then to establish the Social Innovation in Health initiative that we call SIHI, that was launched by the Bertha Center for Social Innovation based at University of Cape Town in South Africa, together with the London School of Hygiene and Tropical Medicine in the UK, TDO, the special program for research and training in infectious disease that is co-sponsored by UNICEF, UNDP, the World Bank, and WHO, and the Scholl Center for Social Entrepreneurship, which is based in Oxford University in the UK. So SIHI is a global network of partners all invested in advancing social innovation in healthcare delivery through research to generate evidence, building capacity, and advocacy. So what is SIHI vision? What we see as a success is an increasing number of research institutions in low and middle income countries playing a leadership role in advancing community engaged social innovation through research to accelerate universal health coverage. And SIHI has very key value that makes it very unique. The first one is adoption of a system lens, to be having a holistic approach. The second is we're all driven by a common passion to enhance equity and accelerate universal health coverage. And then third important value is the inclusive leadership, not telling people what to do, but how to achieve the vision, setting the vision and then inviting contribution and from all partners and giving a lot of flexibility on how to reach that, giving therefore also ownership. So the social innovation in health initiatives is basically a network of partners, and those partners are based in part of them in low and middle income country in the research institution. We're calling them the SIHI research hubs. So what are those hubs? They are basically based in those academic institutions, and they are liaising as a neutral broker, different type of stakeholders, starting with the communities, the social innovators, the academia, the government, the health implementers, private sectors, and other stakeholders of healthcare delivery. So bringing all those actors together to actually identify the problem and also develop the solution and embed research into their process in order to sustain, demonstrate impact, and replicate and scale up as necessary. So those hubs are have a convening power They also catalyze research on social innovation, conduct research on social innovation as well, and develop the capacity for research in their country. They are also raising awareness through storytelling to making the case to enhance the adoption of such an approach, showing that how it works and giving examples. They're convening and building a community, building a movement in order to change the culture. And very importantly, they are institutionalizing social innovation research within the academia system as well as the government system. So how do we see those hubs actually making an impact in contributing to achieve the Sustainable Development Goals, which we definitely want to support? So this is here the result chain. And we can see here that what the hubs are doing basically is bringing research into social innovation. Social innovation is catalyzed, is nurtured, but is existing. It was there, and there are many innovators. But very often, these innovations, after a year, they will not sustain. So very importantly, it has been realized that research can help generate the evidence of what works, what doesn't work, how do you make it work actually longer than a year, how do you sustain it, how do you replicate it, how do you scale it up, how do you demonstrate your impact so that the government is interested in and actually has the evidence and to decide to take the innovation in the system. So this is where this research is critical. And doing so, once the social innovation approach is embedded in the health system, it does contribute directly to the WHO framework of integrated people-centered health services, as well as community engagement, which is very important in order to really identify the right problems and develop the solutions that are really able to change, to make a difference. And that contributes to accelerate the universal health coverage and the achievement of the SDGs. And social innovations have a role, of course, in this case to enhance healthcare delivery, but of course go beyond that health impact. It goes beyond that health impact because it is a holistic approach, a people-centered approach, which is targeting and supporting vulnerable population, reaching the last mile, empowering community, and having this partnership with the different partners, multidisciplinary, intersectoral. So bringing all those together for enhancing all the determinant of social determinant of health. So SIHI is a network that is composed of two different types of partners. So we have the implementing partners that are these hubs that are really moving things actively in order to advance social innovation. They are here illustrated in orange. And they are supported by what we call the contributing partners, which are partners that actually are doing certain of their activities, do meet and do help achieve the SIHI vision. And this way they can support that movement, that journey. But they are not just focused on social innovation. They can be interested in doing any other things. So the idea is to really expand this network. Today, we have 13 research hubs, which are in Africa, 6 of them, in Asia, 4 of them, 2 in Latin America, 1 in Europe, and they're working together and coordinated by the SIHI Secretariat that they all agree is at the moment based in the Philippines, in the University of Manila, Philippines, Manila. So altogether, these partners at the global level are helping to create an enabling environment, an environment where social innovation has its place, is adopted, and can be really transferred to more and more countries. So these include activities, global leadership activities as meetings in order to showcase and in order to really have advocacy and make the case of that success. Their work also calls for research hubs in low and middle income countries to identify who is interested and support them, catalyze them. Global advocacy activities and meetings. There are technical support that is provided in order for the hubs to flourish, and also catalyzing resources such as financing. We have had quite a lot of leverage as well, where for every dollar provided by donors, you would have $2 leverage by the hubs or their partners. And then, of course, creating global partnership, because at the end of the day, the partnership is what matters, working together towards the same goal and making a difference. At the country level, the hubs are embedding social innovation research in the country systems. So there were more than 20 open calls to identify social innovations. And then there were like hundreds of social innovation today have been identified by expert panels, and more than 50 of them have been researched in order to really better understand what works, what doesn't work, what are all these factors that can be inhibiting or enabling, to better understand and make the field richer and growing. The results have been published in international journals. Randomized control trials have been also conducted to make some cases. National events and also international and local events are very important. And very importantly, the films. So there are more than 40 films of social innovation in order to tell the story. And we found that telling the story of such innovation is very important, actually, in order to inspire others and to illustrate it and to enhance and create that enabling environment that we were talking about right before. So here are just a little illustration of recent achievements, such as the Social Innovation Health Monitoring and Evaluation Framework that has been published together by TDR Session SIHI. Last year, we had the special supplement in the Infectious Disease Journal of Infectious Disease of Poverty, and this year we'll have a special supplement on the British Medical Journal. So to conclude, we are really joining forces. SIHI is about really bringing countries to really tell the stories, planting the seed, cross-pollination, and to really strengthen the network and expand in the region. The main activities are about research collaboration, having more and more research collaboration, bringing more evidence, institutionalization of social innovation research in academia and government system, the effective coordination, a network that is coordinated by a secretariat in low and middle income countries, and mechanism in order to share also lessons learned and practices. So I'd like to thank you very much. And what if research could enhance community engaged social innovation and accelerate universal health coverage? And what if you would be interested to also join in this movement and journey that is really of rewarding through the engagement of all people actually involved? And I'd like to thank also the donors, TDR, and all the donors of TDR that have been supporting the SIHI, the Social Innovation in Health Initiative, as well as SIDA, one of the donor of TDR that also added some additional funding. Thank you all and have a nice conference.